Transcultural Nursing Presentation, Hispanic Culture, by Kayla, Kelly, Jasmine, and Heather, August 14th, 2016. Increasing by close to 60% in the last decade, Hispanics make up one of the fastest growing ethnic groups in the country. We chose this culture because of their increasing presence in the healthcare setting. It is imperative for healthcare workers to be knowledgeable about specific cultural values and be able to deliver culturally competent care to the Hispanic and Latino population. Hispanics are the largest and fastest growing minority group in the U.S., comprising of 12.5% of the population. By 2050, Hispanics are expected to make up 25% of the U.S. population. The map shows the top 10 states displaying the largest Hispanic Latino population according to the Census Bureau. Cultural attributes. Hispanics are a diverse ethnic group with several nationalities, cultures, and races. The U.S. Census Bureau defines Hispanics as a person of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish culture or origin, regardless of race. The primary language is Spanish. In this culture, family is significant. It is expected to care for elders and members of the family. Respect is expected for parents and grandparents. Typical family structure includes males as the authority, eldest was in control and most respected. Females provide and care for children, sell crafts, and raise food. They value education, religion, and a strong work ethic. They take great pride in their culture, history, and values. Beliefs and values related to healthcare. Balance between the body, mind, and spirit is very significant in this culture. An imbalance can cause illness. An imbalance is considered having too much heat or cold. Hispanics believe illnesses can be distinguished as either hot or cold. Some cold illnesses are cancer, indigestion, headaches, and pneumonia. Some hot illnesses are diabetes, reflux, hypertension, pregnancy, and anger. Hispanics treat the illness with the opposite balance. For example, pneumonia. It is considered a cold illness and treated with hot teas, steam, and warming blankets. Hispanics will attempt traditional home or modern remedies first. The women rank importance of maintaining their cultures and traditions, caring for family and house, connecting with friends, and having faith as the most important to staying healthy. When self-care does not solve the problem, the Hispanic patient will seek assistance from healthcare providers. Illness is believed to be caused by natural or supernatural causes. Illness is seen as a crisis for the entire family. The outcome of an illness is God's will. Pain and suffering are also considered God's will. We will now discuss some general differences of Hispanic Latino culture throughout the many stages of life, from birth to older adults and elders. Childbearing women and their families. Birth control is generally not allowed other than the rhythm method. Large families and children are considered a blessing. Pregnant women are to avoid all contact with anything that is death-related for fear of harming their unborn child. The women should avoid hot or cold baths and use warm water only. To prevent loss of heat during childbirth, the midwife will typically position herself between the woman's legs to keep the heat in and curses out. Hispanic women who are pregnant want their mother to attend to them during labor. It is common that the husband does not see the wife or child until the labor is over. C-sections are feared, and breastfeeding is felt to provide protection from the pregnancy. After birth, there is a 40-day period of caring for the mother and child, which helps prevent diseases or complications. Women are not to bathe or exercise during this time period after birth. Children 0 to 17 years of age can likely speak English if school-aged and may need an interpreter for parents. Children and youth may not have health insurance due to financial constraints. Education is very important for this culture. Education includes sexual education, STD education, drug use, exercise, and healthy eating habits. Roman Catholics may not be open to the idea of birth control, so sex education is very important. The culture may also request a same-sex physician, as Latinos and Hispanics value modesty. It's important to create a warm and inviting environment. It's also important to assess for maltreatment. Adults conquer the language barrier by using interpreters or the use of English-speaking family members. Many feel they are misunderstood by doctors. Utilize the teach-back method to assess adults' understanding and learning. Family support is most important in this culture and may be useful to allow them to influence decisions. The oldest male is the head of the household. Latinos value kindness, respect, relationships, and modesty. Families may not have health insurance, so community resources are very important. Encourage exercise and healthy eating to prevent diabetes and heart disease. Obesity is very common in this culture. Understand that some Latinos often believe that God controls one's states of health and that one's personal habits have little or no effect. Older adults likely do not speak much English. It's important we assess about their use of herbal supplements. Review medications and techniques, including checking blood sugars and insulin administration. Utilize the teach-back method to assess their learning. Remember to incorporate these important values, especially at the end of life. Sympatia, which is politeness and the avoidance of hostile confrontation. Personalismo, which is the value of warm personal interaction. Respeto is the importance of showing respect to authority figures, usually including healthcare providers. Familismo is collective loyalty to extended family and commitment to family obligation. Fatalismo is the belief that individuals cannot do much to alter fate. The Roman Catholic belief is administering the last rites, 3 of the sacraments, prior to death is very important. Hispanic culture in our community. Not being on time is socially acceptable in the Hispanic community. Therefore, patients and parents may show up late to healthcare appointments but will still be expected to be seen. There is a need to stress that they need to come on time to their appointments. With Hispanic community valuing politeness, patients will expect their healthcare provider to be formally friendly. Therefore, if you're hurried or detached, they may experience resentment or be dissatisfied with their care. Special health concerns are influenced by genetics. culturally influenced diet, and exercise habits. It is also important to note that some Hispanics use folk medicines. When reaching to the Hispanic community, education is key, as well as using the teach-back method. You need to listen to your patients. Churches can be utilized to reach out to local communities. Health clinics and mobile vans are avenues to reaching Hispanics in the community. When communicating, have bilingual interpreters and provide Spanish handouts, as these can help the education process. In summary, education is extremely important and the use of teach-back method must be utilized. Many Hispanics are still Spanish-speaking and would benefit from a bilingual provider or interpreter. Family is of strong significance and can influence healthcare decisions, beliefs, and the way a person takes care of their health. Make sure to allow time for patients to consult their families. Also note many Hispanics will value their family's health over their own. Health is a balance within the body, mind, and spirit. Illness is seen as God's will, with many Hispanics believing they have no influence on their illness. Hispanic women have specific care practices related to childbearing and a 40-day period after birth. Many also do not believe in using birth control. Hispanics value family, kindness, respect, politeness, and modesty. Patients may want to use a same-sex healthcare provider. Hispanics use home remedies, so make sure to ask about all the herbal medicines. Thank you for allowing us to present Hispanic Cultural Awareness presentation. We hope you enjoyed the show and will implement it in your healthcare setting.